So let's talk about S6. So basically, all the remedies from S1, S2, S3, and we have S5 have specific function, okay, specific area to work. So already we know that we have three things to remember when we studied in temperament that one, some organs which produce something, it may be lymph or blood. Okay. Some organs which utilize blood and lymph utilized. Okay. Organs. Some organs will purify the lymphs and the blood. So basically, if all these two things are good, if purification is not good, then whole body will remain all the metabolical waste. Okay, the metabolical waste is not removed by the body. It is present in the body. So what will happen? You will have number of diseases. So this is the most important thing, that purification. If the production is less, no issues. If the utilization is less, no issues. But if purification is less or more, both are dangerous. Okay. If utilization, if the production is more, if the utilization is more, no dangers, but it is also a problem. But if the purification is less or more, it is very much harmful to the body. So which organs purify? We have entry point, we have exit point. Okay. When the entrance, which is also checking point or purification point, exit point is also purification point of the body. So we have lungs, we have kidneys, okay, we have uterus, urethra, urinary bladder. Okay. All these organs are purifying organs. Okay, and skin, all the excretory organs, all these are, but most important are lungs, kidney, urinary bladder. All these three are very important. Lungs, kidney, and urinary bladder. So these are purifying organs. So S6 will work on kidney, urinary bladder. Okay. So this is very important thing you have to remember. So same in X6 also we have 9 plants which are present in the S1. So in place of Naxwamika, we have another plant. This is Solidago virgoria. Solidago. Okay. Virgoria. Okay. So this is the plant used in place of nuts vomica. So then the function of the S6 is changed. So it will work on kidney, okay, urinary bladder, because kidney purifies the lymph and blood, okay, and urinary bladder, it will store and it will remove the lymph and blood, wastage of lymph and blood. So it is the very good remedies for all the issues of the kidney, functional issues of the kidney. Okay, so you can give the S6 in every problem of kidney, urinary bladder, urethra. Okay, all these problems can be solved with S6. And we have another, there is a gland, it is called prostate. Okay, in the prostate gland, but is a gland, endocrine gland. Here you have to use S2. Okay, not S6. If the problem is combined, S6, if the problem is urinary bladder, sometimes what will happen, the muscles of urinary bladders are little loose. Okay, happened. So then it will compress the prostate gland. But there is an infection in the urinary bladder. The infection will affect the prostate gland. That time you have to add S6 also. Okay. If you want to improve the urinary bladder along with prostate gland, you can add S6 also. So here S6 is the best remedy for kidney urinary bladder problems. Functions of kidneys, like nowadays, the most common problem is kidney stones. Kidney stones are most common problem. But you need to give another remedy also along with S6 because of the metabolism is affected. So there's the reason the patient have more calcium in their blood. So the blood purified in the kidney will store all the calcium things, and it will become in the form of stone. This is a simple explanation, but we have different types of stone. We will talk in kidney diseases. So here I want to explain that here the reason is another. The stones are stored in the kidney because it have the capacity to reabsorb those things which are important to your body. Already you studied in uh, physiology of kidney that we have tubules which will restore all the important things, which will restore all the important things which are present in the purifying process. Okay, so there's the reason you have calcium stones there, calcium oxalate, different types of stones we have. So now we have what we have to do, we have to remove the stone as well as improve the metabolism. Along with S6, you can to add S5 also. But in combination, not you combination you have to give, but you have to select S5 with another remedy. How we will discuss. Gradually, I am explaining that along with the reason also be treated. Okay, so S6, but one thing you have to remember that here all the 8 plants are same. One plant is taken and another plant is added. So the basic, along with the basic function, the main function is also treated. So this is the speciality of electrohomeopathy. You can with only one remedy, if you give long period, you doesn't add any other remedy, only S6 will also give wonderful results, but you have to use longer period. It will improve digestion also because the other 8 plants are same. Okay, it will improve the metabolism. It will improve the kidney functions also. Okay, so that's the reason Matty G selected this pathy to cure the diseases. Okay, so S6. So here we talked about S6. Now we have S7. So another combined remedy. We'll call combined remedy, that is S7, not original remedy. In the S7 we have S1 and A1. So all these are used in other groups. So there's a reason Matty sir taken away S1, A1 from the list, because in the S1, S7, the plants which are used in S1, the plants which are used in A1, both are there. So why should we use S7? If a physician want to use S1 in A1, then he will add by himself only. So there's the reason he cut it S7 from the list, and he I used he skipped S7 from that place. Okay. So, but S7, where does S7 works? Which is very important also. So basically, wherever the reason, okay, the we need to improve the digestive or to improve the glandular circulation, okay, and as well as to improve the lymphatic flow, we can use S1 and A1. Okay. Next, we will talk about S8. So in the S8, again, there are the two basic remedies. S1 is same. Okay. In place of S1, we use A1. In place of A1, we are using A3. So again, same answer. Okay. Already you have S1, A3. Why should we make S8 separately? So the physician want to make those remedy, he will make. Okay, so there's a reason S7 is taken away from the list, S8 is taken away from the list because we have S1, A3. So here we have the to improve the overall effect of lymphatic temperament, nutritionally, circulatory, and the lymphatic flow, the functions of the lymph for the lymphatic temperamental patient, you have to add A3. Okay. Okay. So overall functions which are present in the lymphatic temperament. So you have to use A3 with S1. Now you have here we have S1, A1, which is mostly focused on lymphatic flow. Here, not only lymphatic flow, but nutritional effect or functional effect of the lymph will also improve with the help of A3 here. Okay, understood. Next, we have S9. In S9, this is very good because here we have the one extra remedy that is F1. S5, F1. So already same theories, same answer that already you have S5 and F1 separately. Why you should mix? Okay, so there's a reason he taken that S9 from the list. Okay, so but whenever you want to use F1 with S5, you can use. So all the different types of bilious temperamental remedy, bilious temperamental person, you can use along S5 with F1. And if you improve the nervous connection to the liver, then you use F1. Okay. And along with that, if you use the if you want to use the functions to improve the functions, you can use S5F1. Okay, different types of diseases can be used. S1 can be used in different types of diseases along with S5. Next we have S10. So S10 is very important, and it is called second metabolic remedy. Second metabolic remedy. So basically S5 is the first metabolic remedy and S10 is second metabolic remedy. Okay. S10 is second metabolic remedy and also called, if S1 is universal remedy for lymphatic temperamental patients, S10 is also called universal remedy, second universal remedy. Okay, if S1 failed or if the problem, if a person is sick, very sick, he took the treatment, he cured, but there is a weakness in his body. Whatever he is eating, he will not get the digestion proper. He will not able to eat the food. So whenever this condition is appeared, so what Matty did that he will give S1 before food and S10 after food. So then the weakness and the digestive issues which are present in the body, the weakness which is present in the body is cured by S10. S10 after food and S1 before food. Only this remedy will help and will improve overall functions of the body. If after recovery, not during the period of the disease, after recovery, it will give you wonderful results. So let's talk about the plants which are present in the S10. Here we have the number of plants which are present in the uh, S10. Here we have the Ascarius hippocastum. So these are the new plants which are used by the our consider matai very hippocastum, and another is bulbaris vulgaris. This is also present in S5, and Erytheria centurium. I will write the short name, Erytheria centurium, and Cattleya eclandica. Cattleya eclandica. Okay. And another one who's have cinchona, very important plant in this S10 for metabolism. Cinchona caliceae. Cinchona caliceae. And another one we have Cinchona rubra. Okay. And this is also Cinchona rubra in shortcut. I will write. And we have Hydrastis canadensis, the same plants which are used in the S1, and Cochlearia officinalis also used in uh, S10. Sorry, S1, and Nastatium officinalis also used in S1, and Salix alba, new plants, Chlorophylla nodosa. This is the old plant, Semelex medica. Okay, old plant, Tassilago purpura, old plant, Nigra, Veronica officinalis, old plant, and Sambucus nigra. So this is the plants which are used in the S10. So I will send the list. So please note down all the plants. You have to remember all the 10 plants. So already I told you that in the place of S1, where S1 is failed, so you can use S2. If S2 fails, you can use S3. After that, we have one first metabolic remedy, that is S5. If the S1 fails, it will not, if doesn't give proper result, in that place S10. And second thing, the patient have multiple problems. Nowadays, they have hypothyroid, thyroid problems, PCOD, sugar, and multiple issues. Here you can start directly S10, because if you give S5, you will get doesn't get the proper result, because he have number of metabolic problems. So S5 will not work because it is a basic remedy. S10 for it is a advanced remedy. What I can tell that advanced remedy S10. Okay, which are the other remedies which can use with the S10 that are WE, YE. This is the very good. WE is best remedy along with S10. Okay, which will improve the metabolism. YE and A3 is also very good to give the proper nutrition for the metabolic patients, and when one for genetic issues along with S10. So this is all about S10. I think you understood about S10. So it's a number of plants, and this is the second metabolic remedy. And third thing is that after curing the disease, if a patient have weakness, tiredness, letharginess, and digestive issues, you can use S1 before food and S10 after food. I think you understood. So let's conclude here only. We have two remedies which are left in uh, S group, that is S11 and S12. We will talk tomorrow about that. Okay. So if anyone have any doubts, kindly ask.